Hello, everybody. Thank you for being here. Let's go over a couple data points, take some questions. No new deaths over the last 24 hours. We've lost 205 neighbors to date. Obviously, still thinking of them and their families during the pandemic. Looking at testing, testing numbers have been down a little bit. I think this is probably a couple of reasons behind this. One, we've transitioned from diagnostic tests to saliva-based tests for so many different groups and demographics, and I think that will be the trend moving forward. So we'll include both those numbers here. Secondly, insurance is isn't really covering asymptomatic testing. So what you're seeing more is out of the tests you're getting, these are folks that have either had direct contact, work at a nursing home or a senior facility, or have some sort of symptomatic numbers. So it's even when you factor all that in, it's pretty remarkable that we're getting a smaller sample, yet the data still is where it is. So yesterday, 1,321 diagnostic tests, 7-day rolling average for diagnostic tests, 0.75%. One might ask, what's the difference between our numbers and the state's numbers? The state, if you look at what we report out as positives, often there's differences. They'll send us a number, and some of those will be positives from another county, and we work those through with health departments. So when you look at the diagnostic test, there's a little bit of a difference between our 7-day average and theirs. Ours is more accurate. And then when you look at saliva-based tests, 25,000 saliva-based tests at Syracuse University since the beginning of August. None of this has been in any of our data points. We've also tested over 1,800 local school district staff as part of our back-to-school testing, all saliva-based tests. Between Syracuse University and our own school district testing, we've had 3,500 pool tests completed in the last 7 days. From the pool testing at Syracuse University over the last 7 days, there's been one positive. So when you combine our diagnostic and pooled saliva tests, our 7-day rolling average drops from 0.75 to 0.57%. When we look at hospitalizations, 16 in the hospital, nobody in the ICU, so that's good news. When we look at who's in the hospital, 12 Caucasian, 3 African American, 1 of another race. When we look at positive cases, 5 new cases. So good number, 5 new cases. Out of the 5, 2 are travel related, both from within New York State. 1 senior facility, 2 still being contact traced, but at least for the moment, we had no community spread cases over the last 24 hours. So if that holds true, that's good. We haven't been there in a while. Looking at active cases, 176, up 5 from yesterday. Total cases, 3,858. Recoveries, 3,482. When we look at who's been impacted, 2,215 female, 1,643 male, 349 under 19, 789 in their 20s, 513 in their 30s, 457 in their 40s, 573 in their 50s, 429 in their 60s, 310 in their 70s, 277 in their 80s, and 161 in their 90s. Back-to-school testing, we're still doing this week. Some districts have different calendars. Please go to our health department website to pre-register. Again, we've had 1,800 school district staff take advantage of this since we've been doing it. To date, we have had no positive cases from the 1,800 faculty, which is excellent news. Today, we are testing at West Genesee High School for the West Genesee School District. Tomorrow, we will be at Fayetteville Manlius at FM High School. And then on Thursday, Wetzel Elementary School for Liverpool High School, and also MBT Bank Stadium for the City School District. And then Friday, we are doing open testing for staff and students at MBT Bank Stadium on Friday. So that is good. This has been a great effort. I want to thank our emergency management department, Dan Weirs, our director of emergency medical services, Jeff Van Beveren, did a lot of nice work here as well. Jeff got married this weekend too. Disappointed I didn't get invited. We'll remember that, Jeff. But want to congratulate him on his ceremony I didn't get invited to with he and Melissa. Jeff's been working overboard and overtime on all this, so that's great that he got to do that. Happy for him. Quick update related to conversations with our fiscal situation. We have a tentative agreement with CSCA on some furloughs. I wish I had more to talk about related to that. We're just waiting on some final signatures on what we believe we've both agreed to, but certainly working furloughs into this will be helpful to both us and the employees as well. So hopefully that agreement gets signed. We can report on that, and that's a tool that certainly our bargaining unit was looking for at the CSCA, and hopefully we have more to report on that shortly. Questions?
When Senator Schumer was talking about the COVID-4 bill that would provide local areas relief, how confident are you that this area, Onondaga County, will be provided funds?
If it passes, we'll get funding. The question is, we've been told since May that something was going to happen, and it just hasn't. The two sides have been, they started out very far apart. They both put in essentially poison pills in the House bill and the original Senate bill that would never get them to a compromise. I couldn't tell you if they're getting a little closer. It sounded like Senator Schumer was a little bit more confident about that. But certainly, if what I appreciate with the senator's position and the speaker's position is they don't want to get a deal done if there's not help for state and local governments. So that is something that I really appreciate with that, because this is probably the only leverage that is there to get state and local governments help is right now. So hopefully something happens. I don't think it will be as much as the House bill that was passed. We never really thought that type of funding would come our way, but hopefully they can cut a deal, and that money will be very helpful. Again, we've talked about our fiscal situation in 2020, but it doesn't get much better in 2021 when it comes to we're going to take a state cut, and in addition to that, we're not getting back all this lost revenue. And then in 2022, those two factors are the exact same. So for us to help be able to bring back elements of our workforce that we want to bring back and continue to provide the types of services we want to, we need some of that help.
How big of a problem do you see it being once winter comes, snow comes, it affects those people that help clean up the sidewalks and the other areas that rely on safety for people?
Yeah, we're going through, with our ability right now that the legislature has given us to reorganize, we're certainly going to look at different operations that are more seasonal in nature or haven't been at full force, haven't been operating at full capacity first when it comes to workforce disruptions. Certainly we're not going to not have snowplow drivers on the streets or police officers on the streets. So the food, shelter, safety mantra is something that we're looking at when we look at our core service delivery with workforce disruptions.
What's the latest on your plan for layoffs?
Our timeline hasn't changed, Tim. I think the one thing that's changed is that if we get this agreement, this furlough agreement, we can work in furloughs into our overall plan, and that will, I believe that the union will be happy with that. That doesn't mean that we still probably won't have layoffs. We still probably will have some layoffs, but this gives us a tool to blend in the response, and certainly our timing hasn't changed. We have a number to meet, and we have to hit that number by the end of the year. So certainly, mid-September, we will start making moves. Whether it's a furlough or a layoff depends on really us finalizing this agreement.
And that is just for 2020. How do you decide if any of those people come back in 2021?
Yeah, I think part of the at least tentative agreements address a period of time that goes into both fiscal years, just like the legislation we received goes into both fiscal calendars. But the one advantage we have going into 2021 is that we have time now to budget for that. And as painful as this process is, and it's pretty bad, that at least we get to budget for these things and make decisions and can anticipate what we've already learned. But overall, again, we just don't even, we're focused in on the potential disruptions. We've been living with disruption. 460 otherwise positions are normally filled right now that aren't. So certainly we aren't getting those back in 2021 under the current fiscal situation. Any federal help could help us mitigate this next workforce disruption.
Over the weekend, a lot of people got parking tickets. They didn't know if they were real, if they were fake. Now we know that they are not a scam. You also got one. Were you shocked when you saw that there was still an unpaid parking ticket?
Yeah, well, look, and I think in 2010 I may have gotten a parking ticket. I don't remember. I find it hard to believe I would still owe money on a parking ticket. I was a city councilor. I think the newspaper's probably written about 10 stories since then about who had parking tickets. I know they would have checked my name if that was the case. So I don't deny that I may have gotten a parking ticket throughout my adult life. I actually could tell you I've gotten probably multiple parking tickets during my adult life. What I think is questionable is how my name missed all these newspaper articles over the years and missed some opposition research from a political opponent who spent over $1 million beating me over the head. That is what is news to me. So certainly I have no problem paying the mystery 2010 $35 parking ticket, but I just highly doubt I haven't already paid it.
Well, based on your experience with city government, how confident are you in their database and the accuracy of it?
I can just speak from experience that I don't believe my scenario is accurate. Now, when you're in my position, the easiest thing to do is just to pay the $35 and walk away and look at it as a donation, and that's what I'll probably do. But there's no way I'm a city councilor, I get a parking ticket under those circumstances in 2010, and I'm not paying my bill. So I think anytime you're talking about 10 years, 5 years, 6 years, even longer, certainly people will probably be surprised about what they got in the mail. I haven't gotten anything in the mail yet. I'm sure it seems like it all just came recently, so maybe it's there today waiting for me.
I know a lot of the tax payments you're getting are from when things were shut down. How quickly do you think spending real-time tax revenue will return to something comparable to a year before? Are we seeing it in September yet, do you know?
No. I don't think we get to 2019 levels till probably 2022, 2023. Remember, in 2019, you're looking at unemployment at 3.7, 3.6%, and now you're looking at unemployment at 13%. Maybe it's a little bit better now, but until you have folks working and spending money like they regularly were, we're not going to see an uptick in sales tax like that. So that's why we've been talking about this isn't a one-year deal. We're getting hit by the state for $20 million, which normally if that was your only problem would just be so draconian, I'd be screaming to the heavens. But when you have all these other problems, it's not, you put it in perspective. And so we'll get back a reasonable, a modest amount in 2021. We'll have some growth for sure. It won't nearly be what we would need to get all our money back. And then in 22, we'll get some more back. And maybe by 22, 23, we're back at 19 levels. But remember, each year we were seeing growth. We were growing in 20 at almost 5% before the pandemic. That growth is gone. Now it's 3 years worth of growth is gone forever. Now it's just catching up.
So it's not just lag from a shut down business economy, it's a permanent shift in the economic picture of Central New York.
Correct. Correct.
Ryan, Syracuse University so far, I mean, I don't want to jinx them, but they have done really, really well containing COVID, unlike, you know, the terrible examples of other universities. Do you have a sense of how unique their strategy has been among colleges and how, you know, unique their success is?
Yeah, I think right now they have been tremendous. And a lot of it goes to early on, they were working with our teams on what we were seeing and implementing proactive and taking proactive steps. The saliva testing that's used now, they wanted to use it then, it just wasn't approved yet. So there was really a game-changing decision they had to make was, do we wait for the kids to get here and have a more affordable solution, or do we go spend $2 million and send a kit to every kid? They chose to spend $2 million, and now their campus does not have the problems that other campuses have because of that. And so that was the key. You identify who is testing. Remember, most of these young people are testing asymptomatic, and you keep them home, and they get isolated. When they're better in 2 weeks, they can come to school. Then test it again when they got here. Then you build in the wastewater testing in all the buildings, and you've created that bubble we've talked about on campus. So they already are coming into a safe community. They've created that bubble. They've quarantined very well. They've done everything we've asked. And because of that, we have 2 active cases maybe at SU, which is just incredible when you look at how many students compared to smaller campuses and what's happened. But Onondaga, they didn't test the kids coming back, so that's not that much of a surprise that they're running into some problems.
Are you seeing any preventable clusters?
We'll see in 2 weeks. We'll see how we did over Labor Day weekend. Certainly in the last few weeks, we had a couple things where, really 3-4 weeks ago now, that drove some cases, symptomatic people, you know, going out when they shouldn't have, and you should have known better. So, but right now, 5 cases when you're looking at 1,300 diagnostic tests and at least another 500 or so saliva-based tests, we'll take it.
Does each saliva test, 12 per pool, count toward the state requirement for restart?
I don't believe they do right now, Andrew. And that's something certainly I think to get, and hopefully they'll move that way, but if you're changing the way you're testing, and now if you think about it, all of SUNY is, they're all using the upstate test. So that's really, in these communities, that's where the focus is going to be, the resources are going to be there. Then I think you got to incorporate this data into the overall picture, the macro picture, because it's incorporated at the micro level when I get a positive, right? The one pooled kid, they test positive, that hits my positive numbers that I report out every day. The state website just hasn't been factoring all the negative tests that went to it. So I think they'll change that. I think they need to. I think from a statistical standpoint, it's all the same.
Is that, was it 1,200 we need for the region for the restart? Is that even a relevant number?
775 a day. So we're
Okay.
still beating that
But
by,
is it even relevant?
by ourselves. No, it is relevant because if you need to really stay on top of it. And part of why we're disappointed still with the insurance companies is, you know, we've gotten here, we've gotten the economy going again for the most part. We still have some work to do there. But to stay in front of this, you don't stop testing and wait for people to get sick. You go find these hidden pockets, these asymptomatic cases, especially with your communities vulnerable, and then you respond. And so that's what I think, when we started doing that, we saved lives and we really started to bend the curve. And that helped our community get into restart. So it works, no matter who tells you otherwise. And so we need to continue to find ways to continue to do that. Saliva testing is a game changer. It's less expensive. It's done right here. It still does cost some money, but collectively, we're going to be doing some of this in the schools as the schools get going. We're looking at wastewater testing in some of our larger buildings. And certainly, these are all things that we've learned. They work. They've worked now for us to get our economy going. They've worked now in the first month of getting Syracuse University back up and running. So we're going to do the same things and work within our school buildings as they get going as well.
Are you talking about wastewater testing at some of the larger schools?
Yeah. So we're looking right now. We received some money for SU to continue doing it at our county wastewater treatment facilities. We're looking at now, I don't need anybody to tell me that we have COVID in the Metro wastewater treatment facility blueprint. I could tell you that right now. So why don't we use this, micro-target it, so that we're protecting our most vulnerable. Maybe we'll try to work with some nursing homes. Maybe we'll work with some of our larger school buildings.
Is the testing on Friday, that's the one that's open to employees or students?
Correct.
Is that going to be the only event for students?
No, we'll build off of that as well. We're getting through this round, and then we're going to go into the next round. We're working, Dr. Gupta and her team and Dr. Middleton and are thinking of the way to do the regular protocols within the school buildings. Certainly, parents and guardians are going to need to give permission for their child to participate, but it would be a saliva-based test, so less intrusive, so hopefully they will. But there will be consistent testing going on in these buildings, and we're going to let the doctors figure out the best proper protocols on how to do that, and then we'll work on implementing that as well.
You had offered, though, proactive testing to high schoolers, and Jordan Elbridge started today. They didn't have that chance. So did the strategy shift a little bit to not do high schoolers before going into the building?
Well, there's only so much scale you have. So certainly on Friday, any high schooler can go and get a test at MBT Bank Stadium, and we'll do more testing working with those districts. So there's only so much scale you have, and nothing's changed from that. If you look at the kids that have found pockets of the virus, some high school students have. And so we want to get in front of that any way we can. Other questions?